Hi, I'm Dr. Jeff Rohde with Dentalcompare. Today we're with Dr. Scott Benjamin in San Francisco at the CDA convention, taking a look at the new SIROLaser Advance. Dr. Benjamin, you are no stranger to lasers. You've got quite a history with them.
Yes, Jeff. I've been using lasers now for well over 10 years in my practice. I have multiple wavelengths. The best all-around versatile laser that I do have, though, is the SIROLaser Advance. This is a new laser that is just being introduced into the market here in the US, and it offers features that we've never had before. They use the portability and the ease of using this from room to room far exceeds anything else I've ever dealt with in my life.
So what do you find in your office you're using this laser for?
This laser is the laser that we use for basically most all of our soft tissue procedures.
Right.
Everything from laser-assisted hygiene to doing biopsies, frenectomies. Gingival troughing is probably the most common procedure that every dentist does, being able to get rid of tissue that is interfering with the margins of either a direct or an indirect restoration.
Right.
The idea is you want to have good, healthy tissue where it belongs, and you want to have unhealthy tissue removed out of the way to give you the best outcomes for your patients.
So you're not packing cord ever again?
I haven't packed cord now in many years.
I'm sure patients appreciate that.
Patients appreciate it, but more importantly, myself and my staff appreciate it. With the idea that the efficiency of when we have a tooth ready for impression, whether it's conventional impression or whether it's a digital impression, knowing that we're not going to have oozing, bleeding, that the tissue is going to be out of the way becomes an imperative way to get the most efficient care to our patients. So we can get impressions right the first time. We can have dependability on how we're doing it.
Right. So now one of the things that's nice about this is it is portable. So you have multiple treatment rooms you can carry.
Yeah, in my office I have 7 different operatories, and one of the neat features of this laser is it's small, simple, and easy to pick up.
Right.
I can take it into my operatory and very simply set it on my treatment center. So it can be on my instrument tray, and because it has an integrated finger switch, I don't have any cords, any cables, anything else I have to lug around with me. It's battery operated.
Now with that finger switch on there, it does make it easier. What if I'm just kind of used to the foot pedal?
Well, there is an optional wireless foot pedal. The last thing we want in the operatory is another foot pedal. Right. Being able to control the length of the fiber that's being extruded out of the end of the tip really enables us now when we're doing our periodontal procedures and circular debridement to be able to get the laser energy controlled to where we want it to the bottom of the pocket.
Right.
And that's one of the beautiful features is 99% of the control of what we do with the laser is right here, and is a one-handed operation for the clinician.
Right.
The touch screen enables me to switch from one treatment modality to other to be able to adjust my power, to adjust my settings. With a 1-2 click phrase, we can go to any one of my personal favorites or any one of my colleagues' personal favorites. There are individual user setups in here, so each provider that uses the laser has the ability to set it up for themselves the way they want to. And as a doctor, I can control the power and what settings that my hygienist and other people in my practice actually use.
Dr. Scott Benjamin, thank you
very
so
much.
I'm Dr. Jeff Rohde with the new SIROLaser Advance.